Welcome to Bringing Better Health to Life, a program brought to you by Conway Medical Center. My guest is Dr. Peter Ramsey, and he is with Costal Orthopedics. He is actually a hip and knee guy, as they like to say, and welcome to the program.
Thank you.
I want you to first tell me about what you did prior to coming to Costal Orthopedics, a little bit about your background, where you're from, and those kinds of things.
Sure. I grew up outside of Chicago in the suburbs there, and ultimately went to Duke University for my undergraduate. And after graduating from there, I went straight to medical school. And I ended up spending 10 years in Washington, D.C. At Georgetown University for medical school, internship, and residency, and then an additional year there for fellowship in hip and knee replacement.
And I know you studied with some pretty prestigious folks.
I did my fellowship at Anderson Orthopedic Institute. That's in Alexandria, Virginia. And at that facility, in that practice, they actually have 5 surgeons that do nothing but hip and knee replacement. In the course of a year, they do somewhere between 1,800 and 2,000 in a year. They have 4 fellows a year, and I was lucky to be one of them. And actually, during that year, we do about 400 to 450 joint replacements. So it was an exciting time, and able to see where the specialty came from with some of the older surgeons, but also where it's going, and learn the new techniques.
At what point in your growth did you decide you wanted to be a doctor, and then at what point did you decide on orthopedics?
Yeah, I can't say that there was a single moment where I said, aha, I have to do this. But that being said, it was always very interesting to me, whether it was being injured myself or learning about orthopedics from various injuries from my friends, and thought it was very intriguing to be able to help people get back on their feet and get moving quickly. And while some physicians really enjoy the problem solving of looking for the difficult to diagnose problem, I like to know what that problem is and get people going right off the bat. And for me, it was a very good fit. And that's also the reason I decided to go into joint replacement. I think there are very few fields where people can get on their feet that quickly after having months and usually years of pain.
Tell us a little bit about Costal Orthopedics, because I realize that all of you who work there have a different specialty, and yet you do it all, but you do specialize.
Yeah, we actually have 8 physicians now, 2 of which are physiatrists. That means that they deal with chronic pain and neuromuscular issues. But the remainder of the 6 of us are orthopedic surgeons, and we deal with all aspects of the body and are all specially trained in the different areas, no matter what's hurting you, whether it's your hand and wrist or your shoulder, knees, or hips. We recently have a partner, Dr. Yates, who's been a long-term provider in this community, and he just recently retired after 26 years.
Let's mention some of the other doctors, though, that you are affiliated with by name, and that way people can understand the practice.
Well, as I mentioned, Dr. Yates and Dr. Haskin together founded the practice about 26, 27 years ago at this point. We also have Dr. Taylor, who specializes in foot and ankle. As I mentioned, Dr. Haskin specializes in hand and upper extremity. Dr. Pressler, mostly shoulder and knee problems. We have Dr. Mills, who specializes in spine, and our 2 physiatrists who are pain management, and Dr. Elliott, of course, who I partner with in the Joint Replacement Center, who specializes in sports medicine, arthroscopy, and knee replacement.
Dr. Ramsey, I also understand you're a very active part of the joint replacement team here at Conway Medical Center, and I'm just curious how your work with the hospital differs from your work at Costal Orthopedics.
Yeah, I was lucky enough coming down here that Dr. Elliott had helped to set up the program before I got here, but after my training was able to bring a lot of the newer techniques and processes to this hospital. And together, working with both of us working with the hospital, we've been able to really expand the program and offer, I think, patients a better experience in joint replacement program, which is probably as important, if not more so, than a lot of the techniques we use. So for instance, we meet monthly with all the heads of state of the hospital in the nursing department, therapy department, always trying to make the patient experience better, troubleshoot if there's been any issues, and make sure that we're constantly looking for a better experience for our patients.
And I understand that the joint replacement facility here is just second to none throughout the state.
I was very impressed coming down here with the new addition to the hospital, and I'd say that the patient rooms are very spacious, and comfortable for the patients, in particular the family members. We have a physical therapy gym on the unit that's dedicated just to joint replacement patients, and of course a unit that's only for them as well. So I think we offer the patients, when you look from education to booking the surgery, if it comes to that, through the surgery and the post-operative experience, something that's unique to this area.
When we come back, we're going to talk about hip and knee replacement. Do stay with us. We will be right back.
The Conway Medical Center website provides visitors with a comprehensive resource for their health and wellness inquiries. From our homepage, just click onto Search Health Topics for direct access to the HealthWise knowledge base, where you'll find over 5,000 topics about health conditions, medical tests and procedures, medications, support groups, and everyday health and wellness issues. At Conway Medical Center, we know that better informed patients make better health decisions.
For over 50 years, it's been our mission at Garden City Furniture to offer our customers quality home furnishings at an excellent value and to provide personalized service that is second to none. You'll feel at home at Garden City Furniture on 17 Business in Garden City.
The topic is hip and knee replacement, and we're talking with Dr. Peter Ramsey of Costal Orthopedics, and we're going to start with the knee. So Dr. Ramsey, tell us what we're seeing.
This is a model of a knee replacement, and as you can see, you have the bone of the thigh, which is the femur bone, and the tibia down here, and the knee, of course, is a joint in between. When we replace a knee, we more go inside of a knee to replace it than what you might think, chopping above and below and putting something new in. So we actually open up the knee and put a cap on the end of the bone here and a cap on the top of the bone here, and usually a piece of plastic in between. And then we close it back up, and therefore the knee is able to bend and extend and rotate just a little bit as it needs to within the patient's knee. What that does is get rid of the arthritis right off the bat and usually get rid of that pain generator pretty quickly.
I'm sure you see a lot of people all the time who have just put this off until the last second. When do you know that you should be ready? When do you say to yourself, enough is enough?
That's probably the hardest question to answer, and the most individual for each person. For some, in their 80s, say, it may just be about getting rid of that pain and being able to walk across the living room or reach down and pick up their grandchildren. For others in their 50s, it may be about getting back to playing 18 holes of golf instead of just standing there and watching your buddies. So for everybody, it's a different threshold, but by and by, it ends up being a personal decision when the pain is bad enough and you can't control it any other way. I think it's important to note that whether it's hip or knee replacement, the time to do it is up to the patient, and when the symptoms are bad enough, it's not what I say or what the family says. It's about when it's limiting your life.
And when someone has a replacement, as you've just discussed, how long are they laid up?
We try and get you up right away, and actually with the surgery we get you up the same day with the physical therapist. That's not to say you're going to be up walking laps that day, but maybe the next day. We really put an emphasis on early rehabilitation and aggressive physical therapy. And for most people, and this is a broad number as you might imagine depending on your age and physical condition coming in, but for most people a walker for about a week and a cane for about a month is the general guideline I give them. And for people that like to get back to activities such as golf and tennis, it'll probably be a few months, but I generally let people progress as fast as they're comfortable.
Fascinating. Let's move on to the hip. And what do we have here?
This is, again, a model of a hip and a hip replacement, and you can see this side of the pelvic bone, and then the femur bone, again, is the thigh bone. Well, now, of course, we're at the top of the femur, and the joint is the hip joint. Everybody knows, I think, that it's a ball and socket joint. When we do a replacement, what we actually do is open that joint up, get rid of the damaged ball, and you can see in this model the cut's already been made. We put in some sort of a stem that sticks down into the bone, and that holds the ball on top. And then we put a new socket on the pelvic side and ultimately put it back together and close up the joint.
Has this material changed over the years?
The materials are changing constantly. Initially we started off essentially with just a metal ball and a plastic socket. These days there's still metal on plastic. It's better than it ever has been, and for most people we would consider that still the gold standard, at least age 65 or 70 and over. We know reliably it's going to last 15 to 20 years statistically, and probably longer than that. But there are some new advances in materials such as ceramics and metals, which look promising, and as you might imagine, wear a lot less than plastic over time.
You know, whenever we talk to friends or relatives who are in pain, it's usually some sort of orthopedic issue. So I know that with every single patient visit to you and every single surgery, you are changing lives. It's got to be an incredibly rewarding field. But is there anything that's happened recently with a patient that really kind of amazed you too? Maybe their progress, or you really turned their life around?
Yeah, it's something that I personally get used to, but when you stop to look at each day, it's remarkable how fast people get well. And there's a gentleman who's in his 50s, or early 50s, we did recently, who is up walking the same day, went home the next day from surgery. I just saw him in the office just 2 days ago, and when I saw him in the office, he wanted to walk without a cane, and he luckily listened to me, and when he came back, said, "Can I get rid of my cane now? I'm ready to go, and I'd like to get back to work, and can I play golf?" And that's a rewarding thing when you have particularly such a young person. You can get back that quickly. Everybody's a little bit different, but it's rewarding whether it's the young active patient getting back to activities like that, or for instance, I can remember a woman in her 80s who really had gone from her home to a nursing home and thought she was going to live the rest of her days there, and within 2 months, and actually I think it was sooner than that, was back home living independently again, and that's just every bit as rewarding.
That's the kind of successes we like to hear. Dr. Peter Ramsey, thank you so much for being with us.
Yeah,
Saving lives and getting people back to life every single day.
Yes, thank you.
Thank you.